Right, nice to see you, Dr. Ali. We're meeting today to start to complete your placement development plan for your ST5 posting, which will be based with me as your clinical supervisor. Perhaps we could start off, if you could just give me a little pen portrait of what you've been doing in ST4. I mean, obviously I've read your supervisor reports and looked at the ARCP outcome, and it strikes me that everything's on track, that things are going well, but it'd be useful to hear it from your perspective.
Okay, thank you, Dr. Barrett. Yeah, my name is Ilyas Ali. I'm one of the ST4 trainee in inpatient unit, and I'm coming to the end of ST4, and I'll be doing ST5 next year. And I'm here to discuss about my PDP and for the next year.
Lovely. So what did you cover in ST4?
Okay. As an inpatient doctors, I've covered most of the things. For example, I've seen a lot of patients with mild learning disability and things, but I haven't seen much of a severe and profound learning disabilities, which I think I would need it next year. I would like to add that next year in my caseload to gain more experience, to develop skills about assessing and treating them.
Good. Okay, that's helpful. And you did do a bit of community work. So what was that about?
Again, in the community, I've seen patients with mild learning disabilities, and I haven't had much of an experience with severe and profound patients with intellectual disabilities. I would want to see them. I've done quite a lot of home visits and outpatient clinic assessments, and as well as telephone reviews while we had the lockdown and things.
Yes. Lovely, that's great, that's really helpful, thank you. Yeah, so your ST5 year is going to be working with myself in the community and also working with our ID crisis team, which will give you a different aspect of that emergency care. So I think that will complement your ST4 nicely.
Yeah.
And I see from looking at the plan for your special interest sessions that you've done some neurodevelopmental work in ST4 and you're planning for epilepsy and genetics this year. So we'll need to think how we build that into what you're going to choose in your HLOs.
Yeah. Yeah, I think if I'm going to see a lot of profound and severe learning disabilities, and I think epilepsy is common in those patients, so I would need to develop skills on assessing and treating patients with epilepsies. So this is something I'm looking at doing next year. And I think I can attend some special interest placements next year to gain skills in assessing and treating patients with epilepsy.
Lovely, that's great. So we'll focus just for now on the second section and look at the HLOs related to that.
Yeah.
Just because it's the first time we're doing this PDP, I'll briefly scroll back up to look at the headings. So we've got the HLO columns, and then we'll be able to select the relevant capabilities for your ST5 training. I mean, this isn't exhaustive, and it's an interactive document that will develop as the year goes on. But at the start of your training year, we're going to decide what you're going to focus on. We're going to look at what activities you might do to support that. And then we can start to think about the evidence you'll want to hyperlink in. And then we can add any extra notes and look at any notes that we've put in that have come through from last year from your PDP.
Yes, that's
all
great.
right.
Yeah.
If we go down to 2. So 2A is around your communication skills. And I think you've mentioned some quite relevant things here. So I'm going to click on here.
Yeah.
Now here are the 11 options. Now I'm conscious, can you read that all right? Because I know we're doing this remotely. Is that?
I can read it. Yeah, thank you.
Brilliant. Okay. So there's lots of different options. Have you had to think about which are particularly relevant for you in this domain?
Yeah, I did have this, and I thought about number 4. Consistent with communicating with patients across the spectrum of cognitive ability. Yeah, that's the one. Yeah.
Excellent.
Yeah.
So what sort of tasks do you think would be helpful for us to put in here?
I think, as I said, that I would want to have more patients with severe and profound intellectual disabilities in my caseload for next year.
Yeah.
Yeah, and that would allow me to have some experience in assessing them.
So we'll put that down, and interacting with patients with, I think if we include the moderate learning disability group, because I think it's from moderate and greater degrees of IQ impairment that you really see those communication challenges coming in a different way.
Yeah.
With moderate to severe, profound ID. Okay, so that will be one thing. Anything else that will be helpful in this regard?
I'm thinking of doing a course in Makaton as well to help me to improve my communication with patients with intellectual disabilities.
Excellent. And that's something we certainly encourage trainees to do. And I think that would be a really good point in your training to do that, because you'll be able to use the skills. So attend Makaton course and apply skills in clinical practice. So that's good. I think those are very relevant for those.
Yeah.
Let's think about how you could assess this or get this assessed. So obviously you'll be doing some clinical sessions with patients with moderate, severe, profound learning disability. So can you think which workplace-based assessments will be most relevant for you here?
I could do a mini ACE and also do an ACE, I think. The both would be relevant. Yeah?
And it may be worth considering, I mean, we like to get a range of professionals involved in these assessments. So it may be, for example, a speech and language therapist contributing if the mini ACE is around the communication would be helpful, as well as your consultant or another senior colleague doing that. So that's good. That would be good. And the Makaton course, am I right, you'll gain a certificate from that?
I think so, yeah.
Okay. So that will be good. And then again, as I think you've rightly said, some of the sort of clinically focused workplace-based assessments will be relevant.
Yeah. There,
won't they? Let's copy those and add those in again, because that will show you your ability to apply them. So that's really good. And I was pleased to note your mini pat from ST4 highlighted that you've already got very, very strong communication skills with professionals. Yeah, so that's something to note and to build on.
Thank you.
So that's great. Right, so that's enough to be going on with that for now. So let's see, let's choose another one in this domain, because clearly communication is vital for intellectual disability practice. Was there anything else you'd thought of that was relevant here?
Yeah, I think number 11, produce written reports with the limits of expertise, which are coherent, comprehensive, timely and accurate.
Yes, because you'll have had opportunity to do some tribunal reports and things like that as part of your inpatient placement. What were you thinking was still needed in that domain?
I thought of doing some Section 49 reports. I have done quite a lot of capacity assessments, but I haven't done a formal court report for Section 49. Yes. So I would want to develop skills in writing Section 49 reports next year.
That would be really important. And you also mentioned capacity assessments. Have you formally had that assessed as well in ST4? Was that something you just tended to do as you went along?
Yeah, I did just went along and did it, but not a formal assessment. Maybe that's worth looking into doing a formal capacity assessment course as well.
Yes. Capacity assessments. So we'll put that as a starting point.
Yeah.
Right. So let's think. So if you're doing Section 49 reports, what will be the most helpful ways for you of getting that assessed?
I think I need to find the opportunity to do Section 49 reports. I would find colleagues, senior colleagues who have had the request from the courts to do Section 49, and I would be able to do the Section 49 supervised by them or by the clinical supervisor, and I can do DONGs with my clinical supervisor.
Yeah, yeah. So you could do a DONGs around actually writing the report.
Yeah.
It may become part of a case-based discussion as well. That would often be the case.
Yeah.
So I think those would be helpful ways of assessing it.
Yeah.
And also, you know, sort of, and as you very rightly mentioned, your supervisor will be looking at that. So the supervisor's report is going to be able to give key evidence towards that.
Yeah.
Good. Okay. So I think that hopefully that's fairly clear.
Yeah.
I'm just trying to find. So there we go. And I think that's relevant for both the capacity assessments and the Section 49 report writing. So that looks pretty good to me. I think from my perspective, that'll be sufficient for getting you started. Would you agree?
Yeah, that's good. Yeah.
Lovely. So let's move on to the clinical domain. Now, clearly, when we first click on this, it can look quite daunting because there's so many different capabilities.
Yeah.
But clearly, what we need to do is just think about what are the particular aspects we want to focus on now at ST5. And you've certainly mentioned about the more severe end of the learning disability range and assessment there.
Yeah.
But the other thing to think of here is if you're going to be spending time with the ID crisis team, how that can be built into your PDP.
Yeah.
So if you've had a look at the different options, what struck you as most helpful at this stage?
I have looked at it, and quite a few I'm interested in. To start with, I would think about the epilepsy in patients with profound and severe learning disabilities. I think that's number 9.
Okay, excellent. So if we put that one in, and the tasks, I mean, you'll be attending
a special interest clinic.
Epilepsy clinic. And then following on that, it'll be important that you manage some patients with epilepsy on your caseload, I would say.
Yeah.
And apply skills in clinical practice. So that's a good one.
Yeah.
And we can assess this. I mean,
I can do a case-based discussion with the supervisors.
Yeah. And also you'll be getting your special interest supervisor report, won't you?
Yeah.
Which will evidence what you've done. Excellent. So that's a good one.
Yeah.
What else has appealed to you in this?
I also thought about number 6, which is demonstrate skills in the assessment and management of acute mental health crisis in patients with ID. Yeah. Yes. As I'm going to do a crisis placement next year, and I would think I'd get a lot of opportunity to see patients with crisis. So I would like to develop my skills in it.
For crisis assessment and management.
Yeah.
So I think we'll leave it like that because that will be very much linked to your ID crisis placement. That's fine. So that's helpful. Yeah. And I think if we look, there may be other items that's relevant to that as well. Had you picked up any? I was thinking assessment of risk.
Yeah, that's correct. Yeah.
Yeah.
That's number 12. Yeah. And because it's a crisis patient, we need to have a risk assessment as well. So I think I want to develop my skills in assessing the risk in a patient presenting with crisis.
Yes, that's fine. So we can put that as the main activity you're going to do, because that's quite wide ranging and it can cover both of those. Yeah. Let's think through how you're going to get that assessed. Because you'll be working very closely with the team, and obviously we'll look at team working in a different HLO, yeah. But you'll have plenty of people around who can help you with assessments. So which workplace-based assessments do you feel are most relevant for you here?
I think if I'm working with the team, mini-pack would be appropriate here.
Definitely.
Yeah.
And there's some quite senior nursing and psychology staff on the team as well as a consultant. So they'll be able to offer you some workplace-based assessments, I would have thought.
Yeah.
I think it's important that you did at least one ACE with them.
Okay, yeah.
Yeah, and then mini ACEs as well.
Yeah.
Because most of these visits will be done jointly with nursing or psychology or whatever. So I think that will be helpful. Anything else that you might use as a way of assessing?
I could also use DONGs as I can discuss with the patient and sorry, my supervisor.
Yeah,
Can also
yeah.
use case-based discussions as a form of assessment.
Yeah. So there's lots of ways, and I think the issue with crisis placement is often that everybody's so caught up in the moment that you forget to actually get these assessments done.
Yeah.
Always, it's not always easy. So it's just bearing that in mind,
Yeah.
sort of to make sure you don't forget that needs to be done. And
Yeah.
the team are well used to supporting trainees, so I'm sure that won't be an issue. So if I'm going to copy this because it will be the same for both.
Yeah.
Go down. Good. So that gives us 3 in that domain. So we've got the opportunity in this current version of the form for 2 more, though I think when we come to use the active version, there'll be more flexibility. So let's just have a look and see what else seems relevant.
I was also interested in number 7. Cognitive impairment.
Yes, which is a different area to what we've been talking about. So this is cognitive impairment, mainly around dementia. So tell me about that, why that seems relevant.
Right, I think dementia is common in patients with Down syndrome, and we do see a lot of patients. So I would want to develop my skills in assessing the cognitive impairment in patients with Down syndrome, as well as the older patient with intellectual disabilities. So that would be a good one. I can also participate in the dementia care pathway and provide medical input for the team, for the multidisciplinary team.
Yeah. I do. And I'll put input to. But yeah, I think that's excellent because each care pathway will have a medical representative, and you can definitely take that role on. So that's very good. So that's something we can weave into your leadership and management as well. So that's really good.
Yeah.
So let's think about how that will be assessed. Gotta go there. Right, that's fine. Okay. So
we have the multidisciplinary team, psychologist and OT and other professionals. I mean, that would be appropriate, I think, to start with.
Yeah.
Yeah, and also we could discuss about cases. I think, and do case-based discussions.
Yeah, definitely. And you'll have evidence of attending the care pathway meetings.
Yeah,
we can add that in. Minutes. Yeah, so those are some ways of doing this. And again, you can add other things in. This is just to get you started, but that'll cover that. And I suppose related to inputting into the dementia care pathway, you'll need to do some reading, I guess, around national guidance, won't you?
Yeah.
Inputting. So we'll add that in because that's important, including reviewing recent national guidance. Okay, so how could you incorporate that into a workplace-based assessment or evidence it in your portfolio? It doesn't have to be a WBPA.
Reflection. I could reflect on things.
Yes. And also, I mean, that would be really good learning to share with others in the team and the doctors group.
Yeah.
So you'll be presenting at the academic programme. Yeah. So doing a journal club presentation, you could put down. And we need to think about your objectives later on for research and publication. Yeah. Would you be interested in looking at your learning and consider trying to write it up for peer-reviewed publication?
Yes, yeah, absolutely, yeah.
Okay. So those are a range of learning outcomes from there. So that's fine. And I'll put consider. Okay. Consider up for publication, and then if that starts to happen, we can, you'll be able to upload the publication onto your portfolio. So that will be really good. That's fine. So let's do this last one. Anything else here that was relevant for you? The other one I was thinking was number 20. where it's saying about providing expertise and supervision for other members of the team, given you're going to be working with the crisis team. That's something they'll be looking to you for.
Okay.
And also the mainstream community team will be wanting that.
I haven't thought about it, but it is an interesting one. So
yes, and sort of, are you moving on to ST5 now? So you're getting to that middle point of your training where you will be taking more of the leading role on that.
Yeah.
So what do you think will be relevant to put in here?
Again, attending MDT meetings, I guess, and providing input to the meeting. For example, crisis meeting, which happens every day.
And to the community team meeting as well, inputting. And I think also perhaps there should be the opportunity to chair a meeting now. I think that would be helpful.
Yeah.
Because then you'll be in the prime position to be giving an opinion and steering the conversation.
Yeah.
And so I'll put team meetings. Yeah.
And formulation meetings as well.
Yes. Attending. Good. So that will be two good ways to do that.
Yeah.
And assessment wise?
Again, I can get mini part as I'm going to guide and advise other colleagues in the team. And I can also do some case-based discussion. I can discuss with the supervisor about the cases I've seen.
Definitely. And I think donks, because the people can observe you chairing and how you interact with the other members of the team. So I think that's really good.
Yeah.
That's fine. So let's move on to the last one and look at complexity and uncertainty. And obviously already in ST4, you're attending the psychotherapy discussion group, and that will continue. So you'll have further opportunity to present cases. So that's just something for us to note, that's part of your ongoing training.
Yeah, that's true.
So there's a less number of capabilities here, but they're quite, as you would expect, quite complex to think through. So have you had a look at these to see which would be most relevant?
The first one, number one, is we talked about psychotherapy, ongoing participation in reflective practice group or psychotherapy group would be relevant, I think, at this point.
Yes. Attend and participate in. Yes, and that would certainly be a key way to do this. What are your opportunities for getting that assessed?
Yeah, I can do a CBD GA. I can do a case-based discussion in it.
Yeah. Yes. And I mean, that's a prime target for reflection as well.
Yeah.
And perhaps as well as attending the group, I think perhaps if I move this down, what I'm thinking is clinical supervision is a key time for us to be reflecting on complex clinical situations and the psychological meaning of them. So if we put this down round, discuss cases in supervision.
Yeah.
On these. Oops. So we can put reflection, and then we can also have the supervisor report.
Yeah.
And I think CBDs as well. Lovely. So I think that will work well for that. And then let's choose another item. What else do you think would be relevant here?
It's quite a few. I would think about number 3 and number 8 as well.
Okay. Yes, I think 3 is particularly important, given you'll be doing sort of more independent community practice and also crisis work.
Yeah.
Really sort of being clear about what you feel comfortable doing and what you still need support with it is important, you know, for safe practice. So what will you actually practically be doing that would be relevant for this item?
I think it's the feedback from the team, because it's going to be a teamwork. It's a feedback from the team, probably mini pattern thing.
So this column. So I'll move across to this one.
Yeah.
Yeah.
Yeah, and to seeing patients, complex patients, and having difficulties in the clinical situation, I'd have to ask support from the supervisor and discuss with the supervisor and see how they can help in a complex situation.
And bring cases to supervision.
Yeah.
That's fine. And there's something about seeking timely support as well. So obviously supervision is once a week and we can connect at other times as well. But is there an objective we could put down here about, you know, sort of if there's something occurs more acutely, what would you be doing for seeking support then?
I think I would have to involve the team if necessary, crisis team, ICAT team, out of hours team, and possibly on-call consultant as well if necessary.
Yes.
And work as a team, I guess, to help the patient.
So team working with NDT and on-call support systems.
Yeah.
It's good. So certainly mini-PAT will be relevant.
Yeah.
We'll have supervisor report. That will be important. And I imagine we'll be doing CBDs on this.
Yeah.
And then the on-call side of things, have you used the opportunity to get people when you've been on call to do workplace-based assessments for you?
I have, yes, I've done some CBDs with some on-call consultants. Right. And I would also will reflect on the situation, complex situations, what I have had.
Yes. And you may also get the opportunity, for example, to do an ACE or a mini ACE possibly, with one of the teams. So it's always worth doing if you get the chance. Lovely, that's great. So that was that one, and we'll choose one more, and then I think that will be sufficient for currently. So you said number 8.
Yeah, I did.
This is a really important one, managing divergent views about patient care.
Yeah.
So how practically, what's this going to involve?
Again, it's teamwork, and the team, quite a lot of other professionals may have different views about a patient. But I think if I'm chairing the meeting, I need to make a decision where what's the right way of helping the patient there, and decide according to that.
Yeah. So you're right. So there's the contributing element, but also the chairing element will be one thing.
Yeah.
You've talked about doing capacity assessments, and that's very much the case here, that obviously if people lack capacity, you'll be making best interest decisions, and it's managing the divergent views there, which can take place, because that's often when we're called in to do it.
Absolutely.
So completing complex capacity assessments and best. There we go. So I think those would be 2 ways that would be quite important for you to be doing. So contributing and chairing clinical meetings. So you may well be able to get donks for that. And how else would you sort of look at that, get that assessed?
We can, I can do a case-based discussion again with the supervisors.
Yeah.
Yeah, and because, I mean, if it is a divergent views, probably I need some support to see whether a best decision has been taken for the patient. And I could reflect on things, what the other views were and how we come to a conclusion. And there is some learning learning there. And can also do, sometimes you might get ACE and mini ACE if I happen to have a supervisor in the meeting.
Yes, that's fine. And then that will clearly be covered in your supervisor report.
Yeah.
Supervisor report and the mini PAT.
Yeah.
Because that will be the overall impression of you. Lovely, that's great. So I think that quite nicely covers HLO2 at this point. Does that seem reasonable to you?
Yeah, it does. Yeah.
Brilliant. Okay, so I'd like to say thank you very much. We'll take a break now and then maybe continue the discussion later.
Thank
Thanks
you.
very much.
Thank you.